Hmpv or human metapneumovirus infections are common worldwide, with about 10 to 12% of children getting it before the age of 5. More importantly, it is not fatal even in the 65 and above age group, as even if it ends up as a severe infection, it can be fully treated in hospital. Most of the time, it is treated with prescription medicines at home. The present media-created scare is based on a rash of such cases in China, but the fact is it is also a seasonal virus that affects people during the winter. Right now it is winter in most parts of the world, and widespread cases of such infections, especially among young children, are routine. Researchers estimate that about 10% to 12% of respiratory illnesses in children are caused by Hmpv. Most Hmpv cases are mild, but about 5% to 16% of children will develop a lower respiratory tract infection like pneumonia, which is fully treatable. According to the Cleveland Clinic, Hmpv most often causes symptoms similar to a cold, but some people can get very sick. Further, you're more likely to get severely sick the first time you get infected with the virus. This puts young children at greater risk for serious illness. If one has already got infected once, one is more likely to have mild, cold-like symptoms if one gets another Hmpv infection. Adults over 65 years of age and people with respiratory problems or a weakened immune system may also get severe symptoms. Hmpv is also similar to RSV or respiratory syncytial virus. It's part of the same medical grouping as RSV, pneumovirus, and can cause similar symptoms, says the clinic. The peak age for severe illness from Hmpv is between 6 and 12 months, but RSV is more likely to cause severe illness in infants younger than 6 months. Symptoms of Hmpv include cough, fever, runny or stuffy nose, sore throat, wheezing, shortness of breath and rash. Essentially, Hmpv is caused by a virus that uses your cells to make more copies of itself and is part of the same group of viruses that cause RSV, measles and mumps. Hmpv spreads through direct contact with an infected person or by touching things contaminated with the virus. It is commonly contracted by coughing and sneezing by infected persons, by shaking hands, hugging or kissing them, and by touching surfaces or objects like phones, door handles, keyboards or toys. Anyone can get Hmpv, but certain categories of people are more susceptible to it. This includes kids younger than 5, especially premature infants, and if you are older than 65. You are also susceptible if have a weakened immune system from conditions like HIV, cancer or autoimmune disorders, or from medications that suppress your immune system. Those suffering from have asthma or chronic obstructive pulmonary disease or COPD too are susceptible to get infected by the virus. Hmpv is also known to sometimes cause complications. These include bronchiolitis, bronchitis, pneumonia, asthma or COPD flare-ups and ear infections. According to the clinic, healthcare providers usually diagnose Hmpv based on symptoms and health history. They might use a swab to get a sample from your nose or throat. The clinic also says you probably won't be tested for Hmpv unless you have serious symptoms. In cases of serious symptoms, the doctor may also do a bronchoscopy or chest X-rays to look for changes in the airways of your lungs. In short, this is nothing new and nothing to panic about. Thank you for watching this video, and if you have not already done so, please do subscribe to this channel for cutting-edge news reports, explainers and analysis. Thank you once again.